Hi, my name's Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Tuesday, June 23rd, and this is my daily briefing. First, I just want to apologize for missing you yesterday. It was a crazy busy Monday, and I just could not find the time to get the briefing together and recorded. So I'm going to get you kind of up to date today. We're seeing COVID-19 cases increasing across the United States and closer to home here in Montana and in Missoula County. We've had 6 new cases in Missoula County since my last briefing on Thursday. 4 of those are new cases since yesterday, for a total of 14 new cases since June 15th. We currently have 14 active COVID-19 cases with 95 close contacts. That's 109 people directly affected by COVID-19 right now in our county, not counting for the medical professionals and public health specialists that are helping to manage their individual care plans during quarantine and isolation. Active cases and their known contacts are in quarantine and isolation, with some of our new cases still under investigation, and we will continue to monitor and support those folks by medical staff as needed. Please note that our 4 new active cases are reported locally, but they're not yet reported on the state DPHHS COVID-19 data dashboard. The health department here is working with the state to try and reconcile that data right now. To date, we've had 55 cumulative positive cases in Missoula County, and 53 of those cases were identified by testing and 2 were epi-linked. We've had 40 recoveries and 1 death. The state of Montana is reporting 743 cumulative COVID cases, of which 156 are active in 20 counties right now. There have been 21 deaths related to COVID-19. Yellowstone County reported the 21st death in the state over the weekend. With the increase in the number of cases that we're seeing, as well as a high number of close contacts, this is a really good time to remind everyone that it's really important to keep your social circles small. Some jobs and work environments naturally involve more direct interaction between individuals. For instance, teachers who work in a classroom setting could potentially expose the whole class, upwards of 20 or 30 students, as well as any other staff or students that the teacher may regularly interact with. Healthcare workers also see a lot of people throughout the day, just like personal care workers, service industry workers, and others. This is why we keep encouraging you as an individual to keep your social circle small, to kind of try to create a balance between jobs that demand high levels of interpersonal engagement with high risk for COVID exposure and transmission, and our capacity to manage contact tracing effectively. Fewer contacts per case helps to protect our healthcare system and helps to keep the public safe. Last Friday, we announced our countywide Sentinel testing plan at our county testing clinic at the fairgrounds. As of yesterday, Monday, June 22nd, Missoula County, in conjunction with other county partners, is expanding its testing operations to include strategic and coordinated testing across the state's 5 Sentinel testing tiers. At the county level, we continue prioritizing testing services for county residents experiencing COVID-related symptoms, while now broadening testing criteria to include individuals that have been in high-risk environments for COVID-19 exposure and transmission, but are not currently experiencing any COVID symptoms. Sentinel testing really helps us gather a large amount of high-quality data, which is really helpful for understanding the epidemiology patterns and formulating and implementing appropriate response plans. What happens during the Sentinel testing is that a handful of reporting units, like our partner organizations, can efficiently identify and report cases when they have adequate facilities, staffing, supplies, and resources. What's interesting about Sentinel testing is that by intentionally involving a network of strategically selected reporting sites, we can collect data in a way that helps us better identify COVID trends in the county, which means that we will be able to continue using and prioritizing our resources while still protecting our healthcare hub. The governor's tasked state DPHHS with developing a general Sentinel testing framework, allowing local authorities the ability to determine what Sentinel testing will look like at the county level. The state's general Sentinel testing framework consists of 5 tiers. The tiers are not hierarchical in nature, so they're not prioritized over each other, but rather it's a comprehensive list of distinct demographics that might be affected by COVID-19 in different ways. So strategically testing across these different tiers will give us that data that we need to both provide care plans for folks that are sick, as well as really see what COVID is doing in our community. The state's framework consists of Tier 1, which is symptomatic individuals, Tier 2, which are asymptomatic or people who are not having any symptoms, that are staff and residents at long-term care facilities and assisted living facilities. Tier 3 is tribal nations and urban American Indians. Tier 4 is individuals that have been in high-risk environments for COVID exposure and transmission, such as frontline workers and people working in grocery stores and gas stations and restaurants in our community. And Tier 5 are people who are living in group living situations, such as group homes or detention facilities. Across our Sentinel Testing Task Force of community partners, our shared goals really include broadening testing of all individuals with possible COVID-19 symptoms with the goal of early detection, isolation, and contact tracing, achieving a sufficient volume of surveillance testing to accurately monitor changes in the community prevalence of COVID-19. Locally, our coordinated task force includes Providence St. Patrick Hospital, Community Medical Center, Cost Care, Partnership Health Center, Missoula County Detention Facility, Western Montana Clinic, Rocky Mountain Eye, and Big Sky Surgery Center. We've also worked closely with the University of Montana and long-term care facilities and All Nations Health Center here in Missoula. Our integrated efforts mean that a single organization should not exceed its capacity while we continue serving the greater Missoula County together. Partners are now set to provide testing across the different tiers. At the county, we're expanding our testing criteria to meet state DPHHS's Tier 4 standard, which calls for the strategic testing of people not experiencing COVID-related symptoms who have been in high-risk environments for COVID-19 exposure and transmission. More specifically, Missoula City County Health Department is expanding our fairgrounds testing to include healthcare workers, grocery store clerks, service industry workers, daycare and preschool workers, camp staff and counselors, people experiencing homelessness, and county residents returning home to Montana. We continue prioritizing testing for people experiencing symptoms as we expand our testing operations. As a reminder, testing appointments at the county testing clinic at the fairgrounds are by appointment only for patients, regardless of whether or not they present with symptoms. So if you would like to get a test, please call 258-INFO. That's 406-258-4636, Monday through Friday between 8 a.m. and 5 p.m. to connect with a public health specialist about MCCHD's Sentinel testing, as well as learn about other testing options that might better meet your needs. The county clinic is free, it's by appointment only, it's a drive-through only, which really promotes safety, minimizing the risk of exposure and transmission, and saves us our necessary personal protective equipment for our nurses that are working out there. And it's really fast. Once you have an appointment and you arrive at the clinic, you'll spend about 8 minutes at the site from check-in to testing and then going home. Most patients receive their confirmatory results within 24 to 48 hours. We continue offering our mobile testing services in Clinton and Seeley Lake on Tuesdays and Lolo and Frenchtown on Thursdays, and we offer the same testing opportunities in the mobile clinic as well as the fairground site. As such, our mobile testing also expands its operations to include some Sentinel testing criteria as well. Testing in Missoula County is an integrated effort. Different organizations are meeting the needs of different demographics with the ultimate goal of providing services to everyone throughout the network. The health department wants to thank the community partners for all of their hard work and dedication in carrying out this plan, and to our elected officials, particularly Mayor Engen, who was really critical in our ability to secure supplies and resources for testing. Our integrated efforts mean that a single organization should not exceed its capacity while we continue serving the greater Missoula County. So recall that we now have 14 active cases and nearly 100 close contacts. That's 3 times higher than what was previously the highest number of close contacts that the health department here was monitoring. These numbers really do make a big impact to the individuals and families most directly affected, as well as our county partners' ability to continue monitoring and protecting our healthcare hub. COVID-19 is alive and well in Missoula County, as it is much across the state and across the United States and the rest of the world. So to best ensure that we can continue protecting you, please think about taking care of each other. I know people are getting tired of hearing about it, but it is super important to continue wearing that cloth face covering whenever you are out in public. That reduces the likelihood of asymptomatic spread, which is something that we can all get behind to manage COVID in our community. It's also important to continue those things like hand washing frequently, using hand sanitizer if soap and water are not available. Make sure that you are keeping your social circles small. We do want to continue moving forward together, but in order to do that, we need to keep our cases and our contacts really manageable. So that's it for my briefing for today. As always, you can subscribe to me on YouTube under my name, Cindy Farr. That's CindyFarr. Click that little notification bell so you get notified when additional videos are uploaded. You can check out our Facebook page. We are posting for jobs on our Facebook page. You can call 258-INFO. Also, if you're interested in getting a job with us, we could definitely use some more staffing. We've been losing some of our staffing back to their previous jobs. So if you're interested in working with the health department on the COVID response, please call 258-INFO or check out our Facebook page. You can also call 258-INFO if you're experiencing any of the symptoms of COVID-19, even if they're very mild, and you can get that test scheduled. As always, everyone stay healthy, and I will talk to you again tomorrow.